Excellent.
So I've been leading this group advising session for a number of years now, and I always like to start by asking the students that are here to put in the chat what careers they might be thinking about right now. It's okay if you're undecided, but maybe there's something you are interested in exploring. I just like to get a feel for who's all in the room.
We've got dental, dietitian, chiropractic, another dentistry, PT, neuropathy. Oh my gosh. Naturopathy, pediatrician, dietitian. Can tell if I'm watching too many commercials. Medical lab scientist, dietitian. Excellent. I think that's everybody. Oh, one more.
Yeah.
PA,
Ooh,
neurology.
okay. All right. So it looks like a variety of different careers. So I also usually put this up at the start because it just gives you a feel for the range of types of careers that are sort of in the umbrella of health related careers. Maybe some you haven't thought of before. So I know we have a former student that went into audiology and she has come back and spoken to students. And, I didn't know anything about audiology until I heard her talk. Another one that every once in a while I'll see students come through for optometry, um, speech and language pathology might be another one you haven't heard of before. So just to give you an idea of some of these careers that you may not have thought of before. All right, so we're not going to obviously cover all of the different careers today. I'm mostly going to outline for you how you can research these different careers yourself and then find out exactly what you need to do to succeed in that career or what's required for the educational requirements and the career path. So if we start kind of at the top where you start thinking about careers first, and then we'll move our way down to academics. Of course, you need to be aware of the educational level that's required for the career. So we'll see once I pull up some of these websites that sometimes all you need is an associate's degree. Sometimes you need a bachelor's degree. Sometimes you need a master's or a PhD or a professional degree. So it really just depends on the career that you're choosing. Another thing when you're trying to decide on the actual career path that you're interested in, it's really important to take into consideration what types of skills you would be using daily in that career and what the environment would be like. So a good example that I encounter a lot when I'm advising uh, human bio students, they're kind of on the edge of, do I want to go and be a physician? Do I want to be a PA? Maybe nursing is right for me, nurse practitioner. And so I sit down and sort of ask them, well, what do you like to do? Is it more about actually interacting with the patient and caring for the patient because that's more of the nursing route? Are you more interested in sort of the puzzle of diagnostics and coming up with the treatment and, solving problems? That's more physician route, or maybe PA route. And there's an entire hierarchy, when you're in a clinical setting where, the physician tends to be making most of the decisions, and then somebody like a nurse is just doing what they're told. So it really just depends on what you like to do, what makes you happy, what you would feel fulfilled doing, and also what you feel like maybe you'd be good at, right? If we're thinking about academics, obviously the sooner you can get started, in the correct major, taking the correct courses, the better. So if we're thinking about human bio, I feel like the courses that kind of slow people down in the beginning are making sure you're getting through your math requirements and then getting into those intro bio and chem courses that are prerequisites for all of the upper level courses. So most of the time I see people behind in the major only if they don't get those courses out of the way right away. So I wanted to spend a little bit of time on the career planning website because there are a lot of resources, and I can't believe how many students are not aware of the resources available to them. So I teach a first year seminar where we talk about this stuff, but I also teach the biology seminar, which is mostly seniors. And I find a lot of those seniors don't even know about these resources. So if you go to the website, it's sort of going to be broken down into 3 categories. So exploring careers, which might be where you want to start, and then thinking about developing skills related to applications, so resume writing, um, personal statements, interview skills, and then making connections and networking. So we'll just go to the website and I think it will pop up here. Let's get all my crazy tabs out of the way. And so when you go to the website, here are those 3 options. So we're sort of at this point maybe, or maybe some of you know, but this is not a bad place to start. Of course, and Carla will talk about this more at the end, you can always make an appointment with a career advisor, which is not a bad idea. We have this Focus 2 program, which I actually did myself because I was curious. And you all can go to that at some point if you haven't already and log in and take some sort of assessments to see, you know, what your skills are, sort of what you're passionate about. And then it will tell you some possible careers. So if you're just like completely don't know what you want to do, that could be a good place to start. But this is where I want to take you. And this takes you to a couple of different websites. I'm most familiar with the first 2, so I will show you those. And maybe you saw these in like a high school careers class, but the first one, Occupational Outlook Handbook. So I like this because you can just start here and go to healthcare, and it's going to give you a bunch of different possible careers, a very quick summary. And then this is nice. This is what I was talking about before. You can see right away, okay, to be an athletic trainer, you need a master's degree. I think that's, yeah, that's still a master's degree. I was thinking PT for a second, which has gone up a level. Here for the audiologist, I mentioned before, you need a doctoral or professional degree. But then you have things like dental hygienists that need an associate degree, a lot of techs, so like an ultrasound tech or a radiologist tech, they're going to only need an associate's degree. And then some will only require bachelor's degrees, although dietetics has moved up to master's. So some of these haven't been updated, I think, or maybe some programs are a little bit different. But this also will show you the median pay. This is based on 2023 data. But what I like the most, so let's click on chiropractor here, is when you go in, there's a lot more information. So here where it talks about work environment, you know, what a chiropractor actually does. Of course, it's important to understand how you become one. And again, the pay. And you can click on any of these and get a lot more information. It's almost overwhelming how much information you can get on this website. The other link I like is you can go like to chiropractor and then go to similar occupations. And then there's a whole list of things that are similar that you maybe hadn't thought of before. So it can kind of just turn into this, you know, you go to one career and it opens up a whole bunch of other careers you hadn't considered that you can research. I imagine you could take a lot of time going through all of this. And then, of course, you can look into things like the pay. And then I think the next one, the ONET that we're going to go to next, actually makes it even easier to select, like, I want to work in Wisconsin. So what would my salary be like in Wisconsin? Because of course you're going to get paid differently here than you would in New York City or in California. So that's important to take into account as well. A lot of these websites also will have sort of information on job outlook. So is this a job that's going to be in demand? Is it increasing in demand? Is it kind of steady? Is it decreasing in demand for any reason? I would say generally healthcare, it's going up. I don't think I've seen much except growth for healthcare positions. So for chiropractors here, it's projecting a 10% growth in the next 10 years. And it says much faster than the average for all occupations. So then if we go back, we have ONET as well. So here, let's do. So you can get to a specific career, and this is going to give you even more details in terms of what it actually looks like to be an optometrist. What type of skills would you need? What would you be doing daily? What are your work activities? Again, it's almost overwhelming the amount of information. And then you can search and sort of look to see what you need in terms of credentials and training specific to a location you plan on, being in when you get your job at the end. If you go down to the bottom, you can look again, this is what I mentioned before, at wages and employment trends specific to states, or even you can put in, the zip code for Green Bay if you want to. And if you go down, more related occupations, which I think is always nice. And then we'll get to this again later, but a list of professional associations related to that career, which these websites are also very helpful. Carla, is there anything I'm forgetting in terms of these two websites that you would want to make sure the students know about?
You covered it perfectly. You should be a career advisor.
Yes, I'll take on another position.
Why not?
I'm not as familiar with career clusters or this one-step toolkit. Is there anything you want
Yeah.
to say about those? Are there
Um,
new?
some of the there are, and they've gotten rid of some of the information there. They're trying to streamline because the one became really super overwhelming. Some have videos. It's honestly, it's the information between the occupational look handbook. That's kind of the granddaddy, and the rest of them pull information from. And some of the information I used to refer students to in Career One Stop, you can get in ONET, and it's much more concise in ONET.
Okay, so you tend to use
Yeah.
these two.
Yeah, those first
Okay.
two are my favorite ones.
And then you can see if you scroll down here again, you can find even more information in terms of employment projections. I really don't think you have to worry too much in healthcare. So
Agreed.
that is probably not the biggest concern. But if you are concerned about how long you have to go to school, how much it's going to cost for you to get those degrees and how much you're going to make in the end, those are all things you want to research. All right, so if we go back here, so I would encourage you all to spend some time on those websites and maybe, discover some new careers or learn more about the one that you have in your head that maybe you didn't know before. And then the next thing you want to do is start thinking about academic programs. So once you know or have maybe limited your potential careers to a short list, you want to think about, okay, well, what do they require? Do they require a PhD, a professional degree, a master's degree? And then you can go and find information for those specific programs to make sure that you are preparing as best you can while you're in undergrad. So a good way to start researching academic programs, because this is also a little bit of a task, you might think, okay, I want to be, I'm going to use optometrist again because I know there aren't a ton of programs. So maybe you do, and this is going to give you a list of all of the optometry schools. And you can see there's only 39, which is not a lot if you're thinking about the entire United States, and this might even include Canada. I don't remember. And then if you go even more specific here, Wisconsin, you'll find out, nope, sorry, no optometry schools in Wisconsin. But we do have some in Illinois, I know, because several students have gone to Midwestern, just outside of Chicago. And there's also another school, or I guess, oh no, I think it's just these two, right? So I think it's just these two schools. So this is a good place to start. So let's try another one. Oh wait, I'm on location. I should probably search up here. So for chiropractic, let's say, nope, no luck. And actually, I don't know the closest one. Let's see, Minnesota. Now I'm just stabbing it. Oh, there we go.
Yeah.
There's
And then
one.
Palmer College
Palmer
of
is that
Chiropractic's the
Iowa?
most pop. Yeah, so that's in the
Yep.
Dubuque, Iowa. That's the
Yep.
kind of the more common one you see a lot of our students apply
And can you
to.
do, I don't know, can you do Midwest? No, I don't think you can. But
Yeah.
that's a good way to start. My only problem, Oops, if I knew how to spell Iowa. So here's Palmer. And when you click on it, it'll give you a lot more information. So it'll tell you a little bit like how many students there are, location. I think it depends on the program because I feel like I clicked on a few other programs and they gave information about applications and what's required for applications. But what I would recommend when you start to identify these grad or professional programs is then go to the actual website. So go to the Palmer website, or I looked up earlier, like a good example would be MCW, Masters in Public Health, okay? So go to their actual website because that's where you're going to find more information in terms of what the program actually is, application and admissions information, and that's where you're really going to want to spend your time. I would, if it were me, I guess, and I was starting to research different schools, I would make like an Excel sheet and have my schools listed and then have, information about maybe the GPA requirements, if there's an entrance exam, um, and if there's an entrance exam, what the score requirements are. You could even have a column in there where you're highlighting certain course requirements because what you'll see sometimes is if you look at the courses that we require for human biology, every once in a while there's like this one extra class that some programs will require that you'll want to make sure you take as like an upper level elective. Because the thing I hate to see is students finish their human bio degree and they graduate and they go to apply for these programs and realize they're missing like one class. Maybe it's calculus or something like that. So knowing that ahead of time and planning that into your schedule before you graduate is really important. All right, so that's sort of a good way to start. Of course, another way, if you didn't want to use Peterson's, another way you could do it would be just thinking about, okay, where would I like to live? Maybe I know I want to stay in Wisconsin, so I look for programs that are available in Wisconsin. Maybe there's a specific school you'd like to go to. Of course, you don't want to limit yourself. So whenever you're looking at these things, you want to be making a list of several programs that you would apply to. The other thing I'll point out, because I think I forgot to show it, Peterson's has a lot of other stuff as well. So it has prep stuff for like the MCAT and GRE. It also has scholarship searches and things, which I'm not as familiar with, but seems like a good thing to look into if you're worried about covering the cost of school. So there's a lot on these websites, and I find that every time I go back to them, they're a little bit different and they're updating things, but a ton of information available to you. Carla, is there anything else from Peterson's you want to point out?
No, that's it. It's one of those pieces schools can submit information. And so sometimes they like Carly had mentioned, some program pages will have a lot of information, like profile of admitted students, things like that. Others, it'll be just basic. So I echo what she said, go to the program's websites. Yeah, and that's where, like I said, you'll get the most up-to-date information then.
So I kind of think of using Peterson's as finding the programs and then going to the program websites to get all the details and all of the information. I mentioned this already, but you can get to either through the Occupational Outlook Handbook, which I think, let's see, let's try a different one. There were a couple dentists in here, I think. So if you go to more information, you're going to see a ton of different associations and websites that you can go to. Also through ONET, you can find similar lists. So again, just part of the research process and in learning more about the career and learning more through those websites, you can often find programs as well. So if you're just trying to find more programs. Do we have any questions yet?
Okay, not yet.
Okay.
I said, yeah, don't forget, put them in the
Yeah, put
chat
them in the
box and
chat
we
if
will.
anything comes up. All right, so once you get to the program websites, what are you going to be looking for? These are kind of the big things, right? So making sure you know what courses are required to get into that program. Again, you do not want to graduate and then find out you're missing one class. And so that information is going to be found on the program websites. I'll go to this one in just a second. The other thing, obviously, a lot of these programs are going to have a minimum GPA requirement. Sometimes they have it broken up as an overall GPA and a science GPA. So they're looking at those two numbers. The other thing that they take into account here, they don't just look at the number, they look at your transcript. So they look at what courses you took. So they are going to notice, like, especially when it gets to the upper level electives, if you took hard courses like immunology, endocrinology, or if you took the easiest possible courses, because that, tells the program and the members of the admissions committee more about your GPA, right? The other thing, of course, are entrance exams, and this varies now. There are quite a few programs that got rid of entrance exams after the pandemic, but a lot of them still require the entrance exams. All right, so and we'll get back to this in just a second. So we'll go, I think this is the PharmD at Concordia, and this website has also changed a little bit since the last time I went to it. I'm glad I checked it out before we started today. So you can see most of these professional and grad program pages will be the same. They're going to have the same information, but sometimes it's hard to find. So you're going to have to do a little bit of digging to figure out, okay, well, where do they actually tell me the course requirements? And I will tell you with this one, it took me a while because I was looking over here because that's normally where you see things like that. And then I realized, oh, maybe because they have these brochures front and center, maybe I should open a brochure. So if you open the PharmD brochure here for Concordia, it's got a lot of information. So you've got admissions requirements and how to apply, how to be a competitive applicant, which of course is important. And then over here is kind of hidden where you have the coursework. So 8 credits of biology with lab, gen chem with labs, organic chem. So obviously if this is 8 credits, they're looking for 2 semesters of organic chemistry. Here we've got physics. Physics is another weird one. Some programs are looking for 2 semesters of physics, some are looking for 1. Again, calculus is this tricky little class that tends to be required for a lot of programs. And so that, you don't want to necessarily avoid taking calculus just because you think it's going to be hard. It might be required for some of these programs. And so these are the types of things you want to be looking at and putting into that spreadsheet I talked about. Here also we have the minimum GPA. And this is also really important. They're giving you a class profile. So the class of 2026, how many students were enrolled and what their average GPA is. So I want to point out, even though they said a minimum of 2.75, the average of the students getting in is higher than that. Okay. And that's pretty standard. Let's see what else. They've got a lot of information. The other thing you probably want to look at on these program websites is the program curriculum. So these would be the courses that you're taking when you are a professional or grad student. And I think that's important because that is going to really inform your decisions with your upper level electives. So if you see that you have to take certain courses and we offer them as upper level electives, hey, take them here, learn the information, and then when you're in the craziness of professional school, a lot of that information will be review, okay? So any courses that you see in the curriculum that you see similar courses available in our curriculum, I say take them and use those as your upper level electives. Oh, the other important thing, I'm not sure if it's on here for PharmD, probably not. So if you're looking for like a more patient contact type of position, so if you're thinking you're pre-med, pre-PA, pre-PT, they're going to have patient contact hour requirements. That's something else you really want to look for on these program websites. Not only the number of hours they require, but what counts. And so I think we're going to get to an example of that in just a second. And then back to the entrance exams. Obviously, first you want to know what entrance exams are required for the programs that you're interested in. And then we have information on the career planning website again. So this is under the, I think the sort of grad school page. And you can go down, it talks a lot about applications and things like that, personal statements, interviews, and then at the bottom you get to the different entrance exams. So you can click on, let's do optometry again. And this will give you information about the exam, when it's offered, how to actually, apply and take the exam, and information about preparing for the exam. Let me go back here. I think PharmD actually, is this the one that no longer exists? Yeah, it retired the PCAT in January. And then I know some of the graduate programs no longer require the GRE and others do. So that's important to look into. Here's the DAT for dental. So all sorts of information available. I would say websites are useful for information, but the best thing you can do in terms of preparing for entrance exams is talking to other students, maybe a couple years ahead of you, looking, sort of doing the same career path. So join student orgs. If you're thinking dental, join the pre-dental club, and then you'll have other people in that student org that have already taken the DAT, and they can tell you, how you should study, what resources are worth paying the money for. Of course, it always helps to talk to professors as well. And then this last bullet point is important, and we already saw a little bit of this, but I have even more detailed example on the next slide. So the program websites are going to list minimum requirements, but if they also list admitted profiles, that is probably even more important to look at. Not every program will have admitted student information, but a lot of them will. So here's an example for UW-La Crosse's Physician's Assistant Program. So again, if you're just looking at the minimum, they're saying, okay, GPA of 3.0, science GPA of 3.0 as well. But they do have a little disclaimer here due to the highly competitive nature of the program. The GPA of students admitted typically far exceeds this minimum requirement, which we'll see in just a second. And then down here, as I was talking about before, for a lot of these career paths, you'll need patient contact hours before you apply for the programs. And it will be different in terms of what they count. So I have the most experience probably advising pre-med students. So the safe route for pre-med is to do CNA or maybe an EMT or something like that. But it really depends on the program, right? So there's going to be some differences just based on the program. And so these are the sort of types of patient contact hours that would count for UW-La Crosse's PA program. And so the best thing to do if you're thinking about going, one of these routes where you need patient contact hours is get a job as a CNA or as an EMT, and then you're getting paid while you're getting your patient contact hours instead of just like volunteering and getting them that way. All right, so here's that information I was talking about. So on some of the program websites, you will be able to find admitted student data, and that's what you want to look at. So here's the class of 2025. So this is the class that just started at La Crosse in May. Their mean cumulative GPA was a 3.9. So a little bit higher than that 3.0 minimum, right? Don't don't let that discourage you. Like, I don't want students to not apply because they don't have a 3.9. You can see, somebody with 3.74 got in, but just be aware of it and be planning for it, especially if you're early in your college career. Like, GPAs do matter for a lot of these programs just because they're so competitive in terms of the number of people applying and the number that can get in. Decisions have to be made. Here's the science GPA, which is a little bit lower, the age of the applicants. And then here's another one. They did say back here that the patient contact hours are not required for this program, but they sort of suggest 1,000. And you can see the average student was closer to 2,000. But somebody got admitted with 0, and then somebody got admitted with 3,600. So I'm sure they worked as a CNA or something for several years. So that information is useful. This is also useful. So this shows you how many people applied to the program and how many were admitted. And I think I did this math earlier, and it was somewhere between 5 and 6%. So not a lot of students actually getting in because they can't take a lot of students in 1 year. So that is another thing that will differ. So some programs are going to be like lacrosse is one of the more competitive programs. I will say that. So you can look at other PA programs at different schools in different states, and you won't have, quite this, crazy acceptance rate or low acceptance rate. And here again, you have the GPAs, and this is showing you several years worth of data. All right. So let's say you are worried your GPA isn't going to be good enough, or maybe you're worried your entrance exam score isn't going to be good enough. Well, that's not your entire application. So you want to be thinking about what else is going to make you a good applicant. And you can think of this not only just for academic programs, but also just when you are applying for jobs, right? So I think shadowing is probably, we should have had this at the beginning, because I think shadowing is what you should do as soon as possible. As soon as you start to explore careers, you want to get into contact with people in the area and go shadow them and make sure that what they actually do all day is what you think they do all day. And if you can see yourself doing that. Shadowing does look good on an application, but I think of it more as being really important for you making the decision in terms of the career. Of course, volunteering helps. And again, going back to the patient contact thing, if that's required for your field of work. So those of you who are thinking about something like pharmacy or dental, I know a lot of students will just get jobs as, at dental clinics or at pharmacies as pharmacy techs. And that is not only a good way to get experience, in the actual work environment, and it looks good on an application, but it also allows you to start meeting people and networking, because a lot of times if you're working long enough in the dental clinic or in the pharmacy, the dentist or the pharmacist might write you a letter of recommendation, or they will have really good advice in terms of how to prepare for entrance exams and what to do at interviews and all of that good stuff, because they already did it. The other thing you want to start thinking about pretty early on is if you'll need letters of recommendation, who will be writing those? And if this is for a professional program, it's usually going to be required that it's professors writing them, or, like if you have a doctor or, pharmacist, dentist, whoever to write them for you. So it has to be a professional letter of recommendation. You want to be building relationships, especially with your professors or anyone who's going to be writing this letter of recommendation, so that it is actually personal and that it doesn't seem generic, and that the person can write meaningfully about you. The other thing you're likely going to need is some sort of personal statement. So again, these can be pretty tricky. In fact, I read a lot of students' personal statements. If I'm writing them a letter of recommendation, I usually like to read the personal statement, and then I try to give them feedback. I think this is probably the hardest part of the application process, besides maybe the interview. And of course, you have to get through the personal statement first to get to the interview. So I would say don't put that off. I would start writing that months in advance and go through many, many drafts where you have family members read it, friends read it, go to Carla at Career Services and have her read it, come to me, have me read it. Like, whoever you can get to read it, the better. And then in terms of actually putting applications in for some of these programs, it's going to be a common website, like application website, where all of your applications will go sort of in one portal. And when you're references are writing the letters of recommendation, they'll go through it as well. And that's really nice. I would say for like research programs, grad schools, a lot of times you'll have to do them individually, and that's kind of a slow process. Um, but that's just the way it's set up right now. And then again, if you're just wondering what else different programs are considering on your application, of course, you can find information on the websites that we've gone over quite a bit, but also most of these programs have admissions recruiters. Their entire job is to talk to prospective students and answer your questions and make sure that you are prepared to apply for these programs. So don't hesitate to reach out to those recruiters, and you will find information for their contact on the program websites. So I try to bring this up as much as I can in my classes, especially when I'm trying to explain to students why I teach the way I do. When you go to apply for something like, this is vet school, but you'll see a similar thing, whether it's dental school or chiropractic or med school or whatever. Oftentimes, the person that's writing your letter of recommendation is also asked to rank you, like 0 to 5, in these different professional skills. It's also expected that that's what we write about in your letter. So when I'm writing a letter, I'm trying to write specifically about skills I have seen students demonstrate or seen them develop in their time in my courses. And so I speak a lot about group work and oral communication or written communication, maybe their maturity level, their curiosity, like a lot of things. I don't sit and write a letter of recommendation based on if you got an A or not. Like that's not, they can see that on your transcript. So I have to talk more about what I've actually seen you demonstrate. So keep that in mind. So know that your references will be sort of judging your skills based on what they've seen. Pick your references, your letter writers, intentionally to make sure you're picking somebody who has seen these things and will speak highly of you. But also think about developing these things on your own. This is what college is about. I think a lot of people get lost and think college is just about a piece of paper at the end and a GPA and whatever your major is. But the real point of college is to develop these skills so that you're ready for your career. All right, so with all that information, let's start thinking about what you do when, right? So it all depends on what point you are in the process, because I know some of you, we probably have freshmen through seniors in the room right now. If you haven't done any researching for programs, that's definitely where you want to start. Make that Excel sheet with all the different programs that you're interested in and their requirements. Make sure you're getting through your foundational science coursework and getting experience. So that's either patient contact hours, shadowing, whatever that means for your program. I do want to point out, maybe you're not thinking clinical. Maybe you're thinking research, biomedical research or lab work. Then that experience is going to be getting research experience, either faculty lab or summer research internship. If you're interested in that, I can give you the link to the video from last week's Human Bio Seminar, which was all about research. Declare your major, that one's, I think the university now kind of pushes you guys to declare majors almost immediately. So I think instead of declare your major, it's more likely, do you have to change your major or do you want to make adjustments maybe to something like an emphasis? And then start thinking about your letters of recommendation as early as possible and your entrance exam. So if you don't want to take a gap year, and I am a huge fan of gap years, everybody that's had me in class knows this. So don't be afraid to take a gap year. I had 4. It was the best decision I ever made, even though I don't think it was a conscious decision. If you don't want to take a gap year, so if your plan is to finish undergrad and go right into a professional or grad program, then you need to be applying to grad programs the summer before senior year, which means you have to have the entrance exam done by then. Which means you also need to make sure you have your letters of recommendation lined up. And also it depends on the entrance exam, but something like the MCAT, you absolutely need to have physics and biochemistry done. So you also have to plan your coursework and when you have those courses according to when you're going to take the entrance exam. So I think the best way to do this is think, when would I like to start, dental school, and then work backwards from that and set yourself up a little timeline. Okay. All right, so I think most of you are probably human biology majors. You probably are already aware of the fact that we have 6 different emphases. The nice thing about our major is it doesn't matter what emphasis you're in the beginning. They all have a lot of the same core courses, so the same intro bio and chem and that type of thing. So if you decide to change your emphasis like sophomore, junior year, it's not going to put you behind at all. So usually the health science major is going to be pre-med, PA, maybe dental, chiropractic, things like that, optometry. And then exercise science will be more the physical therapy, athletic training, and then nutritional sciences and dietetics. We have the dietetics program here now. That's a master's level program. So this emphasis would be maybe if you plan on going on to that. Also, if you are interested in nutritional science, other careers outside of dietetics or research. Cytotech is quite specialized, and this is undergoing some changes right now, but if you want to work in a lab and primarily be looking at lab specimens under the microscope all day and working with a pathologist to help, diagnose cancer and things like that, cytotech is a really good option. This one's a little unique because you do your coursework here, but then you go to another school for the internship part. And we have connections with Mayo Clinic and Madison, although the Madison one is changing a little bit right now. If you're interested in cytotech, I would recommend talking to Dr. Marker or Dr. Merkel. They know the most about this emphasis and the programs. We also have a general emphasis, and this one I think gets overlooked a lot, but I liked Dr. Brusich used to describe it as the build your own major because it has more flexibility. And so we've actually seen some physician's assistant students, or pre-physician's assistant, I should say, move from health science to general because they've looked at the PA programs they want to apply to, and they've seen that the programs don't require all the classes that we require for the health science emphasis. And so the general emphasis gives them a little more flexibility to choose exactly the coursework they need. I would say to do the general emphasis well, you need to do your research in terms of what program you're trying to get into, to make sure that you take the right courses. And then the applied public health one, this one is relatively new, but public health is a huge, field right now. Masters in public health is a great program to consider after undergrad. And so that's another option here as well. And then I'm just going to click out to the website here to show you a few more things. So if you want to think more specifically about careers related to human biology, you've got some information here. So you've got a whole list of different careers, maybe things you haven't thought of before, like science writer. And then you can also link here to recent graduates and alumni, and you can see where some of them work, which is really nice. Oh, there's Noel. Then they have some information, of course, about our master's program. So we have master's in athletic training, a master's in nutrition and integrated health. And then here, where have some of our recent graduates gone to professional or graduate school? There's Dr. Merkel down there. And then I wanted to show you a couple more things. See if I can find where things are now here about human bio. So here you can link to student orgs. That's a really good way to meet other students with similar career paths and have them as mentors as well. Internships aren't quite as big in human bio, but definitely if you're interested in like maybe a lab position or something. I know I've had students go work at what's the cheese one? What's the cheese?
Schreiber.
Yes,
Yeah,
Schreiber.
Schreiber.
So if you're
Yeah.
interested in food science, things like that, so we do have some internships, and you can always talk to a faculty or career advisor about some of that research. So again, we just had a human bio seminar on this. Really the best thing is to try to get in contact with faculty members about research. And if you can't get into a faculty lab, then you want to start looking into summer research programs. So there's a bunch of information on the website, but I would say the best thing to do is is talk to your professors, go to office hours. That's true of everything, really. I felt like where was oh yeah. So here's some of our alumni that are, I think they're doing a lot with Dr. Merkel's professions class, but also all of these people, we have their email addresses. They're happy to talk to students. They love it. So if you see anyone on here and you want to get connected to them, talk to me or Dr. Merkel. And of course, we have a lot of contacts that are not listed. So again, talk to your faculty. Um, it doesn't have to be your faculty advisor either. It can be any faculty member that you feel comfortable going to office hours and talking to them. I thought there was one more thing I wanted to show here, but now I've lost myself. These new websites are very easy to kind of get, like, you start going in circles. You're not sure where you are anymore. All right. Of course, if you're thinking just about course planning and how you're going to get done in so many years and how you're going to take the classes that are necessary for the programs that you want to apply to, this is just showing you for the general emphasis. And I mentioned this before, but the supporting courses, so the lower level courses, are going to be identical for all human bio emphases. It isn't until you get to the upper level courses and the electives that it starts to go down sort of different paths. All right. I mean, you can also get to this information again on the Human Bio website, so you can go here to specific emphases and get more information on the courses. Although sometimes I feel like this isn't updated as fast as I want it to be. Right? I mean, I wouldn't want to be the person whoever has to do all of that, but if you have questions about courses and maybe what courses to take in which order, or what upper level electives are going to set you up best for whatever career or program you're thinking of, talk to your faculty advisors or any professor in human biology, and they will help you with that, especially before registration. All right, enough of me. Carla, your slide.
That's ta-da. I echo the piece about talking to the faculty, mentors, faculty that you have for classes, because again, they're your subject matter experts. So whatever area you're looking at for the research, things like that, they are not scary. I've had some students that'll come to me and I'm like, no, we're very fortunate at UW Green Bay being, again, we're a big enough campus to have different resources, but our faculty, like I said, are amazing. So definitely reach out to them. So to meet with your career advisor, so all students have an assigned career advisor. As I alluded to before, so many of you, I'm your advisor, especially if you're human biology. If you're a double major, you might have someone else. So you can find your assigned career advisor in SIS. You're also assigned, so then just again, a refresher, there's your professional advisor, that's your academic advisor, and then your faculty mentor. So you can schedule appointments with your career advisor through Navigate. Just a heads up, right now the advisors are about booking out 2-3 weeks, especially as we get closer to registration starting for classes. So if you know you want a question answered sooner versus later, don't wait to make that appointment. And you can meet people in person or virtually on Teams. So again, if you make an appointment, so for instance, if you want to meet to have your resume reviewed, You'll generally have to bring a copy with you to the appointment, or if it's virtual, to send it a full working day in advance. If it's a personal statement, we need it even further in advance, a minimum of 2 working days. And what we have you do is submit the essay that you've written along with the requirements. So that way we can compare, well, what were the questions you had to answer? Is there a character limit? So I was working with a student who's applying for a program. They had to answer 5 questions, and each response had to be less than 3,000 characters. So where in others, it'll be a page, page characters, page limit, things like that. So I joke, and Carly and I've had this discussion, like I look at things like the grammar, are you answering the question? But I'm not a biologist. I'm not an immunologist. So that's where your faculty are really great, because if you did research with someone, they're going to know what you need to put in there to, again, address what you did for your research, your courses, things like that. So we look at things from different lenses. That's why having multiple people look at it. And again, for clarity, conciseness, personality, again, that can shine through then. So again, there's times, like I said, they might refer you to someone else, we'll refer you to someone else. But again, definitely, again, check in with your career advisor on those different things. Interviewing, we can talk to you about interviewing, and then we can conduct interviews based upon, so we have lists of questions based on different programs. So again, we can put you the practice interview, talk to you about interviewing, to help you feel more comfortable with that part, because sometimes that's the part students get stressed out about. They're like, I finally made it to this point. Now I have to interview. So don't let that freak you out. So, and if you need professional attire, we do have our career closet in this Green Bay office. So in the central career office, and you can come in, it's free attire. You can get, suits, blouses, tops, button-up shirts, ties, dress pants, so that you look professional, especially if you have an on-site interview. I think that was, yeah, I think that was all I was going to talk about that.
Okay. Well, we have 5 minutes for questions.
All right. So questions, anyone, and if you want to, so again, there's nothing in the chat. Feel free to put in the chat, or if you want to, let's
Raise your
see.
hand. Is there a way?
Yeah, I can't remember with Zoom if you can raise your hand or if you have to. I was going to say I can. Oh, yep, here. Oh, yeah, you are allowed. You can unmute yourselves. Okay, so yeah. There you go. So if you do want to unmute yourself and ask the question, others, if you want to type in the box, either way.
So I think what we can do is, Carla, you and I can stick around for a little bit, and if anybody has questions, they can stay. If you don't have any questions, you're welcome to leave. Carla will send you the information, the PowerPoint and the recording. And remember, get in contact with faculty, with your advisors, start planning things. The earlier, the better.
Excellent.
Thanks for
I'll
coming, everyone. Oh, we
I'll
got some.
stop the recording now. And then, like I said, there are a question came in. Excellent. All right. So I'll
Can
stop
your
the
minor
recording.
be